Hello, so this is chapter 16, Over-the-Counter Analgesics, Unexpected Agents of Misuse and Danger. Introduction. These drugs are not recreational and do not induce euphoria. About 70% of adults over the age of 65 take an over-the-counter analgesic at least once a week. Many drug abusers will also take drugs during or after their use of other compounds. Annually in the United States, 16,500 people die from over-the-counter induced reactions. A short history of OTC analgesics. Folk healers have long used various plant or tree extracts for a variety of treatments. Hippocrates suggested patients with fever or in mild pain chew willow bark 2,400 years ago. In 1800, the active ingredient salicin was isolated. In 1898, Bayer introduced acetylsalicylic acid called aspirin. Probicin acids, including naproxen and ibuprofen, as well as acetaminophen, are also used. NSAIDs stands for non-steroidal anti-inflammatory drugs. Approximately 20 in the United States, although most are available only by prescription. Aspirin and propionic acids are derivatives of the exception. Medical uses of over-the-counter analgesics, so aspirin. It has many applications, including reducing fever by dilating blood vessels and encouraging sweating, which bleeds off heat. Low doses are protective against myocardial infarction and have been benefit during such an event. It is effective as an adjacent treatment for transient ischemic attack, TIA. Sorry about that. Little tongue tied today with some of these words. They might be useful for also treating type 2 diabetes. The propionic acids include ibuprofen, naproxen, ketoprofen, all of which are available without prescription. Used to control fever, mild to moderate levels of pain, and inflammation. All NSAIDs may increase analgesic potential in narcotics and can better control pain without higher dose. Mixed evidence suggests regular use of NSAIDs may slow the progression of Alzheimer's disease and vascular dementia. Normal dosage levels of OTC analgesics. Aspirin, 650 milligrams of aspirin has the same analgesic potential as 50 milligrams of Demerol or 32 milligrams of codeine. Ceiling effects occurs at 1,000 milligrams every 4 hours. It should not be taken for more than 10 days without a physician's care. Acetaminophen, 325 to 650 milligrams every 4 hours, with a ceiling effect at 1,000 milligrams every 4 hours. Use with caution in those with alcohol use disorder. Ibuprofen, 200 to 400 milligrams every 4 hours for pain control. Maximum of 3,200 milligrams in 24 hours should be taken. Pharmacology of over-the-counter analgesics. Aspirin. Effects are slowed when taken with food as it buffers the ingestion. Rapidly biotransformed by the liver into water-soluble metabolites, which are promptly removed from the blood by the kidney. Appears to work at the site of the injury and in the hypothalamus. Acetaminophen. Administered orally in tablet, capsule, or liquid form. The peak effects seen between 30 to 120 minutes after a single dose. Ibuprofen. Peak effect achieved in 30 to 90 minutes. Is absorbed in protein and slowly released over time. Must be taken for 2 to 4 weeks to achieve full anti-inflammatory effect. Naproxen. Begins working within an hour and effects last 7 to 8 hours. 30% of a given dose is biotransformed in the liver into inactive metabolics. Acetaminophen has a cumulative effect on liver, so should not be used longer than 10 days in a row. It can be nephrotoxic at high doses, damaging the kidneys. Was once thought to be related to end-stage renal disease, but that is no longer a concern. Complications caused by over-the-counter analgesics use. Aspirin, most commonly used over-the-counter analgesic in the United States. Could cause minor bleeding in brain or GI tract, bleeding ulcers. 20% of those with any allergy may have an allergic reaction to aspirin. Tinnitus and hepatotoxicity. Complications caused by over-the-counter might contribute to Ray's syndrome in children, implication in failure of intrauterine device, IUD, to prevent pregnancy. Ibuprofen shares many of the same complications as aspirin, implicated as a cause of blurred vision and formation of cataracts. It should not be used by patients with autoimmune symptoms like lupus. Can cause aseptic meningitis. Can increase blood levels with lithium, which can have a small therapeutic window. Over-the-counter overdoses. Acetaminophen, sometimes called the safest of all the analgesics, 100,000 cases of acetaminophen overdose each year. 20% of patients who overdose die, usually from acute liver failure. Of those who live, 30% still die within a year after a liver transplant. Objective evidence of toxicity might not appear until 12 to 24 hours after the overdose was ingested. Untreated acetaminophen overdose will progress through 4 stages. Stage 1, within 30 minutes to 24 hours, anorexia, nausea, vomiting, diaphoresis. Stage 2, 24 to 72 hours, abdominal pain, oliguria, and swollen, painful liver. Abnormal liver function, kidneys show signs of dysfunction. Stage 3, 72 to 96 hours, nausea, vomiting, jaundice, symptoms of liver failure, hemorrhage, hypoglycemia, renal failure, hypotensive episodes, death might occur. Stage 4, 4 days to 2 weeks. Liver begins to repair itself, healing can last for months or even years. Over-the-counter overdoses for 5, aspirin. A toxic dose for aspirin is 10 grams for an adult and 150 milligrams for children. Symptoms of aspirin toxicity include the following: headache, dizziness, tinnitus, mental confusion, delirium, hallucinations, increased sweating, thirst, visual problems, and hearing impairment, relentless excitement, apprehension, tremor, seizures, stupor, coma, hypotension, and possibly death. Ibuprofen. Symptoms of ibuprofen toxicity include the following: seizures, acute renal failure, abdominal pain, nausea, drowsiness, excessive bleeding. Naproxen. Lethal dose not known. due to the infrequency of this case. Symptoms of naproxen toxicity include the following: lethargy, acute renal failure, hypogastric pain, nausea, coma, convulsions, drowsiness, excessive bleeding. So that's it. Thank you for listening.